Hello everybody, this is Sharon Paulier again. We're teaching the electronic medical record module. We will start module 2 tonight with part 2 of the EMR overview that I discussed previously in module 1. It's a continuation of what an EMR is and different variables about the EMR. So let's get started. So as I mentioned, we're going to continue on with our overview of what an EMR is. So let's start with what we plan on discussing in this module. First off, I'm going to talk about improved diagnostics and outcomes. Secondly, I'm going to talk about improved care coordination. We will also be discussing efficiencies and cost savings of using an EMR. Fourthly, we're going to cover EMR incentives, including monetary incentives. And lastly, I'll be discussing HIE, which is also known as the Health Information Exchange. So as I mentioned, we're going to get started by talking about how an EMR improves diagnostics and outcomes for a patient. EMRs can aid in the diagnosis of diseases and reduce medical errors. Information is more legible within the EMR. The information is all in one place, and it gives the physician greater access to more information at one time and in one place. EMRs can also improve patient safety and support better patient outcomes. By keeping records of patients' medications and allergies, this is very helpful to prevent possible adverse errors that can occur. When a medication is prescribed, there is a behind-the-scenes check done for drug to allergy, drug to drug. For instance, if a patient's taking one drug and then a new prescription is prescribed for a new medication, maybe those two medications don't go together, but now we have a record, so an alert would come up if there was an issue. Same thing with an allergy. As I mentioned, if a patient is allergic to penicillin and penicillin's prescribed, an alert or pop-up would come up to indicate an issue. Continuing on with our discussion of improved diagnostics and outcomes, let's talk about the fact that info gathered by a primary care physician, whether it's in a doctor's office or whether it's in a hospital, can help a doctor where, in a case where a patient's unconscious. Once that information is in the record, it's in the record. So for instance, if a patient has some sort of allergy or they're allergic to some kind of medication or whatever it is, and it's documented, and then that same patient shows up in an emergency room unconscious, but they have ID on them, so the doctors know that who the patient is, the physicians are able to pull up the medical record and see how to diagnose and treat the patient. This is very helpful and prevents many, unanticipated problems. EMRs also expose potential safety problems when they occur. Everything's there now, and it helps point out problems when and if they do occur. They also enable evidence-based decisions at point of care. So by gathering all this information, the system actually helps in diagnosing the patient's problem. So we call that evidence-based decision or diagnosis, and it helps. Certain protocols are set up based on certain complaints, and this is all within the system and helps in treating the patient. The EMRs provide built-in safeguards against treatments that would result in adverse events. Now I'd like to talk about improving care coordination amongst healthcare providers. Medical care requires teams of healthcare professionals, primary care providers, specialists, nurses, technicians. It takes a village, as they say. Each team has specific expertise and view of the patient. The doctor, may be looking at the patient as a whole, where the specialist may be looking at one specific part of the patient. Likewise, nurses, tend to have a different angle on the patient as well. This results in fragmented and disconnected facts and clusters of symptoms. So everyone has their own opinion. We need a coordinated care to aid the patient. So the results of improving care coordination are many. One is we improve information sharing. This way everyone has the same information. We now have viewable and up-to-date medication and allergy lists. This is very important, as I said, for checking, for helping patients when they're unconscious, so medications aren't incorrectly ordered. We also have an order entry at point of care. Now, as I said, lab tests can be ordered right from the doctor's office, radiology, x-ray can be ordered. They can be done either on site or they can be sent to an off-site. Maybe a lab is being collected, but it's going out to a lab where they're going to result it there, and the result's going to come back in. And we also now have standardization, very important, of data. Order sets and care plans help to treat patients using evidence-based medicine. Now let's talk about the efficiencies and cost savings of using an EMR. What are the efficiencies? Well, for one, it's easy access to patient information from anywhere. You could be in your home, you could be in your office, you could be at the hospital, you could be at the golf course if they have access to Wi-Fi and you can get on your laptop or your phone. It's access from anywhere. This is very important. You can also track electronic messages to staff, clinicians, and hospitals. Most of these electronic medical records have a communication tool built within to communicate to staff and other clinicians. They also have an automated formulary check that is done by health plans. Very important. You can also order and receipt lab test and diagnostic images such as x-rays, CAT scans, ultrasounds. You can order it, as I mentioned. It can go out and the results are brought right back into the electronic medical record tied to the order. We also have links to public health systems such as Department of Health registries and communicable disease databases. There's many more that I failed to list right here. Next, I'd like to discuss the cost savings of an EMR. There are many. First off, it reduces transcription costs. There's no longer that need to transcribe, to dictate your note, and then send it out to have a transcriptionist, type it up and bring it back and enter it into the chart. Now it's just documented right into the chart. Whether you type in the information or some of the EMRs use Dragon, which is also a dictating type tool that whereby you can dictate right into the EMR. There's also a reduced cost for chart pulls, storage, and refiling. Often medical records are stored off-site, in an off-site location, and where they're being, you're being charged for that. Every time you need the record back for maybe a legal reason or whatever, you have to pay to pull the record and then refile the record. These are costs that were incurred, and we will be eliminating them by using an EMR. We also have improved and more accurate reimbursement coding with improved documentation for highly compensated codes. This is very important. You want to get the most, especially physicians, money that you can. So you want to code correctly. Reimbursements are based on coding. Better coding, better reimbursement. Another saving is reduced medical errors through better access to patient data and error prevention alerts. You want to prevent errors at all costs. Now the tools are there to do that. Lastly, I just want to state that improved patient health quality of care through better disease management and patient education. It's easy to educate patients when you're reminded to do so, and the tools are there to help you. I want to briefly talk about the EMR incentives. As many of you know, the American Recovery Reinvestment Act of 2009, ARA as it's often called, authorizes the Center for Medicare and Medicaid Services, also referred to as CMS, to provide incentive payments to eligible professionals and hospitals who adopt, implement, upgrade, or demonstrate meaningful use of certified electronic health record technology. CMS is making available up to $27 billion in EHR incentive payments, or as much as $44,000 through Medicare or $63,750 through Medicaid per eligible healthcare professional. This is a lot of money, and many physicians are already receiving this money. Eligible hospitals, including critical access hospitals, CAHs, can also qualify for incentive payments totaling some $2 million or more. Obviously, at the hospital level, there's much more money and much more reason and incentive to go after this money. More importantly, though, meaningful use is on better patient care. Lastly, for this module, I'd like to talk about HIEs, or Health Information Exchange. Electronic Health Information Exchange, also referred to as HIEs, allow doctors, nurses, pharmacists, other healthcare providers, and patients to appropriately access and securely share a patient's vital medical information electronically. This improves the speed, quality, and safety, as well as the cost of patient care. It allows providers to avoid readmission. This is always very costly and not a good thing for hospitals, doctors, or patients. It also allows providers to avoid medication errors, improve diagnoses, and decrease duplicate testing. How often is does someone, prescribe or order a test that was already done? This is a problem, for the insurance companies not paying, the patient having a test done that didn't need to be done a second time. So again, tracking information, having the information available, all very important. Thank you.